Great. Thank you, John, so much for having me. And thank you for everyone here that is attending today. I am really, really excited to talk about this topic. Cannabis for older adults is one of the main questions I get often by, my own peers who are trying to help their parents as they age. And it's one of the groups that I see the best results with. So I really am excited about this. So I'm going to launch into it. Just know, please drop any questions you have for me right in the chat. I'll try to get through my portion. And then, like John said, we'll circle back around and get questions at the end. So please feel free to do that throughout the presentation, and we will get back to you. I'm going to attempt to share my screen right now. There we go. Okay, so I like to start this with a little context, because a lot of times when we talk about cannabis, the conversation is sort of around smoking weed, this still illicit in some places plant that it has quite a reputation, some of it unearned. So what I really want you guys to be thinking about while we have this discussion is, what are we targeting when we're using cannabis? Why does it work? Often I talk about how cannabis can be used to treat such a wide variety of conditions, and people are like, this sounds fake. Like how can one thing work so well? And I promise you it's not snake oil. The key to this is understanding that our target is the endocannabinoid system. So it's one of the very largest receptor systems in our body, whose role is regulation, homeostasis. So it plays a crucial role regulating our physiology, our mood, and our day-to-day experience. As you can see, it's controlling things like sleep, energy, our autonomic nervous system, which is responsible for all the automatic processes of our body, our pain response, our immune system, our response to stress. So it is an amazing therapeutic target, and that is why we use it. We produce cannabinoids, which are the compounds both within the plant cannabis and within our own body. Those are the endocannabinoids. So just know that even if you've never used cannabis in your life, you have endocannabinoids flowing through your body all the time, helping you to, manage and live in this world. So think about the endocannabinoid system as our, main goal, stimulating that. So why should older adults consider cannabis? The main reason is this. Over 36% of the population age 60 and up take 5 or more drugs. 20% of those people take 10 or more. It's a big issue in our society. That's considered polypharmacy, when you take 5 or more drugs at a time. Increased incidence of side effects and adverse effects. So polypharmacy right now in our country is the 5th leading cause of death in older adults. When we get older, our body's ability to metabolize drugs decreases. We're not as efficient at it, again, increasing drug interactions and increasing side effects. So cannabis really is a safer substitute for many of the drugs on the Beers criteria, which those are drugs that should be avoided or used with extreme caution in older adults, and they're quite commonly prescribed. Antipsychotics, benzodiazepines like Valium, hypnotics, sleep drugs, muscle relaxants, neurologic agents like gabapentin or Lyrica, antidepressants, several different kinds, as well as anti-inflammatories. Those are all on the Beers list, and they're associated with increased hospitalization and increased death in older adults. And they are so commonly prescribed, and often not just one of them, but several of them someone will be taking. And so these are the drugs that if you are an older adult and you're taking them, or if you have a family member, or if you're a medical provider, you should always be checking to see which of these drugs can be adjusted and, perhaps discontinued or reduced for our older population. Cannabis is a great substitute for all of these categories of drugs. One of the things I want to point out when it comes to safety as well as opioids, we have, an opioid crisis still going on in America, and cannabis has shown to be a great replacement for opioids, either to help reduce or replace it. And if you look at this chart, which I just like to show people about, the safety profile of these drugs, if you see the Y axis up and down, that is dependence, low to high, risk of dependence. And then from left to right is showing the difference between the active dose of a drug and the lethal dose. So if you look at marijuana over here on the left lower corner, you can see, we don't have one case of somebody overdosing and dying on cannabis, and the potential for abuse and addiction is low. Up at the top right, you'll see in red, heroin, morphine, opioids, both a very low lethal dose and a very high dependence potential. So swapping this out greatly will improve your safety profile if that's a medication that you use. So when we think about cannabis dosing, these are just some kind of, just because cannabis is a relatively very safe drug doesn't mean it doesn't come with any risk. So I just kind of want to put this out there. Some cautions that you should think of if you're thinking about trying this. You want to start low and go slow with the dosing. So start very low, especially with older adults. 1 to 2 milligrams of THC is where I'd start people, and then slowly increase it, aiming for the lowest effective dose. You just don't want to be giving more of it than you need. And so that is the approach that we use when we work with patients. One thing that's important to note is that cannabis can increase the potential fall risk for someone. So it can increase dizziness, it can increase sleepiness. At high doses, it can impact coordination. And if you already have a mobility impairment or a fall risk going on with yourself or with a patient, you want to be careful using cannabis. And again, start low. It is safe at many different ranges, but for older adults, we see good efficacy at low doses, and that helps minimize things like the fall risk. Also, you want to be mindful when you're choosing a method of consumption, which I'll talk about that a little bit next. And you also want to check for medication interactions. Just like I said, cannabis is a safe drug, but it does have medication interactions. So you want to have the medication profile looked over before, by a clinician before you start using cannabis. And you definitely don't want to start stopping other medications without the supervision of a provider. It's kind of an art to switch out these medications and replace with cannabis, and you'll get better results if you, take a sort of, planned scientific approach to it. And medication interactions do exist. There's about maybe 50 to 70 drugs that you really want to watch with cannabis, whether it's a complete contraindication, not always the case. A lot of times it just has to do with dosing or timing of administration, but it's important to know that when you're considering this as an option. So the different methods of consuming cannabis, which you may have heard about, and I'll talk a little bit about, you can start with, I tend to recommend not an inhaled method for most people, including older adults, because of respiratory effects, but inhaled is the most commonly known and popular method of using cannabis. Its benefit is a fast onset. It can work in 5-10 minutes. Here it says effects lasting up to 6 hours, but I see less duration usually with inhaled. Typically, you can get maybe 3 to 4 hours of good pain relief from inhaled medicine, not as much as you'd get with ingesting it, having an edible. That can take, anywhere from a half hour to 2 hours to kick in, but the effects can last up to 12 hours. So if you're looking for a solution that is going to give you a longer duration of action, you want to be looking at an edible or an ingested method. Also up here at the top, the sublingual or buccal is another method of that is similar to this, which is under the tongue or between the gum and the cheek is buccal. And that's something that, you'd have either a lozenge or an oil, hold it in your mouth, suck on it for 3 to 5 minutes, and then swallow. And you get a kind of a blended effect. You get a bit of a faster onset, maybe 20 to 30 minutes because you have some absorption already in the mouth, but then you also get the extended duration from ingesting it. So that's a great method that I use with a ton of patients. And the last thing is topical. We have a ton of creams and oils on the market that can be really helpful for things like stiff joints and pain, back pain, muscle spasms. We also have some other forms that are kind of similar in activity to the topical. We have suppositories that you can use, which is, a good method for not everybody, but for some people, really helpful. Doesn't cause a lot of psychoactive effects, just like the topical. You can use that liberally and you're not going to get high from it. So those are, the main methods of consumption you'll see out there. Sometimes blending a couple of them is the way to go when you're approaching cannabis treatment. But just so you know, you do not have to smoke to get high or to feel the effects. You definitely can use one of these other methods and improve the safety of cannabis. The other thing I want to really mention, which, I get asked all the time, we see all of these kind of acronyms, right? And the different cannabinoids is what they're called. THC, the main one that we know, that's Cheech and Chong that we've known in the past. It's the compound responsible for getting you high, but that is not all it does. It's been shown to be a really effective treatment for all different types of chronic pain, nerve pain, which we have, few things that work well for that. Spasticity and tremors. Parkinson's patients get a lot of relief from this, as do patients with multiple sclerosis. It's proven to improve anxiety and depression, relieve insomnia, reduce agitation associated with dementia, increase appetite, which is a great benefit for a lot of seniors. And it also is super effective against chemo-induced nausea and vomiting, and many other conditions. So that's going to be the probably the most common cannabinoid that you're going to see, and the one that, culturally we're most familiar with. But I'm guessing you've probably also heard of CBD, cannabidiol. There's sort of a craze around it right now, but for good reason. We have a lot of research on this. It's a totally non-intoxicating compound, so it does not get you high. And one great benefit for using it in older adults is that it has a moderating effect on the high of THC. So it reduces side effects like anxiety, sleepiness, dizziness, and it also increases the duration of action of THC. So it can help increase the amount of time that you're getting pain relief using THC if you combine it with CBD. So you'll see when you go into a dispensary that CBD there is often dosed in a ratio of CBD to THC. So you'll see a 1-to-1, a 4-to-1, a 20-to-1. That's what that means. It's a combination of typically CBD and THC. But on its own, CBD is a really powerful anti-inflammatory. If you have osteoarthritis or rheumatoid arthritis, it's a great thing to add to your regimen. It is really helpful for anxiety, and it's a powerful anti-seizure medication. So, those are just some basics on these two cannabinoids, and you'll see others when you go out there. But when you're a newbie approaching this, you want to be incorporating both of these compounds into your regimen to get the best results. So let me just go over a few areas where I really think this could be beneficial for older adults. Chronic pain, number one. Remember with this, low and slow. CBD, the benefits of CBD are often seen after, a month or so of regular use. THC, you'll feel that effect right away. So you want to be low and slow. Consider starting with a blended formula like I discussed. A 1-to-1's a pretty good neutral place to start. If you start with a low dose of a 1-to-1, I'd say that just generally, without, knowing specifics for an older adult of their health profile, that a 1-to-1's generally a good place to start, low dose. Again, CBD, good for arthritis. THC, helpful for nerve pain. So as you're tweaking your dosing, if you have a lot of arthritis, you might consider going up a 2-to-1, a 4-to-1 of CBD to THC to get more of the benefits of the CBD And the opposite for neuropathy. Often those patients find they do a little bit better with maybe a 1-to-2 ratio of CBD to THC. So, this is a very interesting treatment because it puts a lot of the control in the hands of the patient or the patient's caregiver, whoever's kind of planning the dosing of this medication, and getting knowledgeable about these compounds that you're working with is important. When it comes to chronic pain, I want to say that I see best results with a layered treatment. That means combining one or more methods to attack the pain in more than one way. I really like the idea of a localized option in addition to an edible. So, a low dose edible that you would ingest, and then using a pain cream on top of that, on your knees or on your hands. Or if you have lower back pain, degenerative disc disease, herniated discs in your lower back, consider a suppository. I have a lot of patients that get good relief with that. Additionally, if they're on opioids, the suppository can help with the side effect of constipation, and it does not cause increased or very intense psychoactive effects or a high. So it's a safe option. As I said earlier, the inhaled route is not preferred for me because it causes, some respiratory effects. If you have COPD, I would not recommend using inhaled cannabis. But for some people, especially I'm thinking about my patients that have the chemo-induced nausea and vomiting. If you're nauseous, often taking something orally is not the best choice. So I have some patients that do like the inhaled method, and I recommend using a dry herb vaporizer. Google it. It's heating the cannabis below the burning point so it releases much less tar and other irritants into the lungs while still delivering the THC, the CBD, whatever you're vaping, without burning it. So, if you need to use the inhaled route, there are some harm reduction measures and some strategies you can use to do that more safely. Okay, the next is insomnia. Now, over 40% of older adults, and this was a statistic I looked up, but to be honest, I'd say this is a lowball estimate of older adults suffering from sleep issues. And almost all of them with insomnia end up on sleep medications, which, as I mentioned, is on the Beers list. So, you want to avoid using things like Ambien or other sleep aids. They could, increase the risk of hospitalization and death where you don't want it. Insomnia itself increases our risk for heart disease, stroke, cognitive decline, depression, metabolic syndrome or type 2 diabetes, and death. So we want to treat that. We want to make sure people are getting good sleep. And one way to do it is with cannabis. And this, about 90% of our patients, my personal patients that use cannabis for insomnia, get a benefit from it for sleep. It is a great sleep aid. And one of the main things I hear back all the time is, I don't feel groggy or hungover when I wake up. So they're getting restorative sleep, which is not always what I hear about things like Ambien or Lunesta or the other sleep aids that had become so prominent in, use. For the case of insomnia, I really like that sublingual administration I was talking about because of that dual kind of fast onset plus the duration that you get out of it. That to me is a really good method for nighttime. I often recommend a full spectrum cannabis oil or tincture. You just place a few drops under your tongue, hold it, 3 to 5 minutes, I'd say, for max effects, 90 seconds if you can't tolerate it, and then swallow. It's a great option. And I'd say start with low dose, 1-to-1 CBD or THC. Now, I also listed another cannabinoid, CBN. You'll see on the market some products that have a THC CBN mixture. And that has been shown in some studies to be better for sleep in some people than the CBD THC mixture. Because for some patients, they find CBD, especially at low doses, can be stimulating. So in that case, I would suggest a 1-to-1 THC CBN. And I would say, in most dispensaries, at least in my state, we are seeing that in every dispensary as an option, some form of THC, CBN. All right, and let's see. Anxiety and agitation in patients with dementia. This is a huge issue for patients that suffer from any form of dementia, Alzheimer's. The anxiety and agitation is present in nearly 100% of these patients at some point or another in the progression of their disease. And it is one of the most distressing symptoms for both the patient and their family or caregivers. It is totally associated with early institutionalization. And there's a lot of people that are, trying to keep their parents out of a nursing home and having a hard time with these specific symptoms. Try cannabis before you make a decision. A trial of this is a good idea. The antipsychotics that they often offer for these symptoms, all on the Beers list again, and they have a lot of other side effects that just make them, a rough choice for anyone that has to take them, and definitely something that you should use with a lot of consideration before choosing it for an older adult. So a little science right here. One of the things that cannabis does that is great for these patients is it stimulates autophagy, which is critical for healthy aging. What autophagy is within your cells, it's the process of when parts of the cell are old, abnormal, damaged, the cell eats and kills those parts, recycles it. So it keeps the cells, healthy and moving. And as we age, our ability to do that is kind of reduced, and in patients with cognitive decline, it's especially reduced. Cannabis can help stimulate that. Also, the whole way that cannabis works is enhancing communication between our cells. So that's really important. If we can get that in the brains of patients with Alzheimer's or dementia, that's what we need. And we have a lot of studies showing neuroprotectives and neural anti-inflammatory properties in the brain for cannabis. Again, for this population, edibles is what I think of. That full spectrum cannabis oil tincture that I was talking about can be easily mixed into food. And I also like the sublingual buccal approach, as in like a lozenge or a popsicle. Often I recommend patients mix oil into yogurt and freeze it with a popsicle stick and have the patient just eat the popsicle. That way they're kind of sucking on it. They're getting some absorption in their mouth as well, and getting a faster onset, especially if they're experiencing anxiety and agitation, and as well as the longer lasting effect of the edible. So that would be my general strategy for that. And if you or a loved one has a dementia diagnosis, consider this. There's a lot of information out there, and of course you can always reach out. I'm happy to consult with that. If anybody has any questions now or later, please reach out to me. The last thing I want to talk about is just talking to older adults about cannabis. This can be an odd conversation for some people, depending on, especially if you're talking to your parents or a friend, broaching this subject can be awkward for some people, but do not be afraid to ask about your parents' history of use. There's a pretty kind of clear generation divide, but a lot of the folks that are older adults now are former hippies, right? So you could have a conversation that these people in this graphic I made, reliving your mom's old hippie days on that way, or you could find out, as John put it the other day, they voted for Nixon. So they have no experience. And either way, it's a great starting place to kind of have an open discussion. It can be helpful to disclose your own experience with cannabis. And just start the conversation that way. Definitely emphasize what I emphasized before. You do not have to smoke, and you do not even have to get high to derive benefits from cannabis. It can be really helpful to share, the growing body of scientific research, or even data showing increased use in this age group for successfully treating their symptoms safely. And I also think, number one, focus on that potential for reducing or replacing other medications. That's what we're trying to do here. Making the the safety, overall safety profile of their medication regimen safer with cannabis, and often improving efficacy. And highly suggested, find someone like me, enlist the help of a cannabis clinician, someone that can kind of back up, give a little credibility to these scientific research that we've done. Often I'm enlisted to help families talk to other providers about incorporating cannabis, and that's a big thing that we cannabis clinicians do. So just know that there are professionals out there that do this and are resources for your family. So that's where you can find me. And we'll share all that information. But if you have questions later on after this, please, I would love to connect with you. So let me stop sharing my screen and pull you back up. All right, so let's launch into questions. Does anybody have any questions?
Right. So can you guys hear me? Can you hear me okay?
I can hear you, John.
Okay, excellent. So I've been copying questions down, and so Tanya Hedges asks, is there a need to consider weaning to lower doses with this population if they've been on it for a while?
I definitely think so, especially, at lower doses, if they're on that low and slow, under 5 milligrams at a time, perhaps you'd be okay without weaning. But I always think it's a good idea to be gentle with ourselves and our brain. And so, you're going to get less of a effect. And if you've been on cannabis for a long time, you certainly can develop, some form of physical dependence, in that if you come off of it, you'll notice, you might find an increase in insomnia if you come off it too fast. You might, have a resurgence of symptoms in a way that you don't want. So slowly tapering, I think, is the best method. And I think to reduce any, I hesitate to call it withdrawal, because that's so associated with, heroin, opioids, other things. It's nothing that intense, but certainly I always suggest a slow taper.
Excellent. And Ryan asks, is there a quick and comprehensive list of medications known to have negative side effects with cannabis that you're aware of? Something like that would be an incredible resource for non-medical professionals.
You know what? I almost was going to pop that in the slides that I had, and then I thought, I won't kill him with that. But there is, and John, if it's something that I could share with the attendees after this.
Absolutely. Yeah. You'll be, and people are asking, and so this presentation will be available on the Consumer Cannabis Council's website just after, and we'll send out a link to everybody that was on this webinar, so that you can refer to it and check it out whenever you want. We've also got a question from Lee, who is asking, what are the negative effects from long-term use?
So the negative effects of long-term use, and it's really, let's say, I want to clarify or emphasize that it's dependent on your dose and how you're using it. With supervised medical use of cannabis, we see very few long-term negative side effects. Some of the more negative side effects we see are in some of the studies, and a lot of that is more along the lines of illicit cannabis use or concerning cannabis use. So if somebody continues to use high dose THC for a long time, they're going to develop tolerance, less efficacy to the medication. So, that's why incorporating with CBD and keeping the dose low is important. There's been some studies showing negative psychiatric side effects with use of high dose THC, including a risk for psychosis, especially if you have a personal history of that. So if you do, definitely consult with a cannabis clinician before you start using cannabis, because that's kind of a big one. But again, with low dose kind of medical cannabis use, we don't see a lot of negative side effects long term. And when it comes to chronic pain management, for example, the long-term effects of opioids, the neurologic agents, anti-inflammatories, now those are very clear. That can be internal bleeding, it can be severe addiction, it can be death, it can be, so again, when we look at cannabis, think of it as a harm reduction tool, and always evaluate the risks and benefits for the particular person, because sometimes the benefits outweigh the risks, and sometimes the risks outweigh the benefits. And
awesome. So Katie, Tanya would like to know what is recommended for patients with GI motility issues as it relates to absorption and the effects.
I would say I've seen a lot of good results with beverages. There's in Illinois something on the market that is a cannabis beverage. It has a technology that allows it to have a faster absorption, 15 to 20 minutes. So with people with a lot of GI inflammation or impaired gut motility, a beverage is a good option. The inhaled cannabis, is an option. And also transdermal patches, which are available in many states, penetrates more into your systemic circulation a little bit more deeply than a regular topical. And that would be another good way, I'd say, to get cannabis in with someone who doesn't have great absorption in the gut.
Tanya also asks, is there a recommendation for insomnia and hot flashes associated with menopause? By the way, Tanya, a subject that we'll be tackling in a future webinar, I believe in 2 months or 3 months. The schedule, you'll be notified appropriately, but go ahead.
Yeah, so I've seen really good results with hot flashes in a few patients. And let me give a caveat. I've seen it all in patients that were not super experienced cannabis users, but taking a low dose 5-to-1 higher CBD ratio type product for hot flashes. Not sure the mechanism of how that's been working, but I have about 6 people that are doing well on a formulation similar to that. So like a higher CBD, I've personally seen it to be more helpful for hot flashes. For insomnia, THC is still what I do, and I do a lower dose, 5-10 milligrams maybe, but start low, start with 5, and that should really be helpful for sleep. And I do an ingestible method.
Excellent. Carol would like to know if mixing cannabis oil into food products is a good thing. Then what is the ratio of oil to the edible product? And then are there any recipes?
There's a ton of recipes out there, but how I kind of suggest it for patients is, yes, you can mix it in, and go get yourself just a bottle of a tincture. So an oil-based tincture, and either, they make 1-to-1, they make it in a variety, and just mix that into food. It really does not matter really how much you mix in. I mean, I'd say, often I'm going like put a dose into a container of yogurt, or it mixes well into high fat things. So I'd say, pairing it with dairy, pairing it with avocado is good. Anything like that. I mean, I wouldn't like mix it into a giant soup and then attempt to get, a high dose out of that if you've put a small volume into a large volume, but definitely you can do that. It's a good way to get the cannabis in a little bit longer on the onset, 45 to 60 minutes usually, sometimes longer, but you can definitely mix that into food. And the easiest way to do it is just purchase some full spectrum cannabis oil from the dispensary.
Excellent. Susan would like to know what drugs interact with the THC CBD, because since they had a bad reaction.
Okay, well, I mean, I could be listing, and honestly, you can please reach out to me if you have a specific question about a medicine you have. Let me pull up the list of medications that I was referring to in that other slide that I made. Okay. So, off the top of my head, THC, anything that's going to make you drowsy, whether it's like an allergy medication, a sleeping pill, a pain medication, THC is going to increase those kind of sedative effects. If you have a medication that causes you to have a higher heart rate and you co-administer that with THC, you can expect to have more tachycardia when you co-administer. Additionally, you know, with the THC, let me pull up if there's some specific ones I'm not thinking of. With CBD, definitely clobazam, if you're on that medication, you want to be extremely careful using that with CBD, almost a contraindication, or use only with professional supervision. Those two together have an effect where using the CBD with this clobazam, or Onfi is the brand name of it, will result in having like 3 times as much of that Onfi medication in your system than you're aiming for. So it can be very dangerous. You know, with THC, it tends to be that, you know, anything that's going to make you dizzy, your heart beating fast, sleepy, you use that with THC, it's going to increase the effects. Just because a couple people have asked this. Sorry, John, I'm just pulling this up on my radar. So I'm going to share this all with you, but, you know, certain things like tricyclic antidepressants, not a good mix with THC. So amitriptyline, Elavil, that's commonly prescribed to older people for sleep. Cyclobenzaprine, if you're on a muscle relaxer, again, that can make you more loopy if you take it with THC. You know, if you have a cardiac condition, get a consult before you start using cannabis. THC can, you know, affect that. So, I will share the list with you guys.
We'll send it out. We'll send it out as an attachment with the email to everybody. We'll send a link. All right. Just a few more questions before we wrap up. Allison would like to know, what's the name of the vape apparatus that you stated that was best to use?
Okay, so it's a dry flower vape. And I would say there's a lot of brands out there. So it's a dry herb or a dry flower vaporizer. You really can't go wrong with the brand Storz & Bickel. Like, this is not an endorsement, but it's one of the oldest first brands. And in Europe, they are allowed to sell like medical grade products. That's not allowed in the United States yet because it's federally illegal for cannabis, but this brand makes medical grade equipment. So I'd say Storz & Bickel, they make a handheld dryer vaporizer, and they make a tabletop called the Volcano, which is sort of a famous product. Both great products. There's also some less expensive ones on the market. And, I'd say brands like PAX or, they're eluding me right now, but right. they're just Google dry herb vaporizer. You'll find some good ones. Storz & Bickel, you can't go wrong though.
Right. So Phyllis would like to know how to coordinate care with a primary doctor or a rheumatologist if they are resistant to this form of treatment.
Definitely, you can, number one, contact someone like me that can help be your interface. Speak to a cannabis clinician, and they can help consult with that other doctor. Also, Google is your friend. Look up, research your condition in cannabis and see if you can find some stuff. Doctors like to see research. If they're resistant, a lot of times doctors are barred from the to talking about cannabis based on the institution that they work for. If they work for a hospital that accepts federal funding, they often will not certify people to use medical cannabis. And it doesn't have anything to do with that's not the right treatment for you. It's that the doctor might not be trained or comfortable with it. The doctor might have old training because most medical schools do not cover this, the endocannabinoid system, and really medically using cannabis. So the doctor might be lacking training and not be comfortable with it, or they might be barred based on their institution. So those are other reasons why you might be getting, kind of the door slammed in your face when it comes to cannabis. So enlisting a cannabis nurse or a doctor that specializes in cannabis can be really helpful in breaking that barrier.
Excellent. And one last question, Tanya would like to know, we see anticoagulants a lot in this age group, and we've read that it may increase clotting time. Talk about that a little bit.
Yeah, Tanya's a nurse. So that's the one that was eluding me, warfarin. If you are on warfarin, there is an interaction. Cannabis can increase clotting time. So that doesn't necessarily mean it's a contraindication, but you're going to want to work with your providers to potentially adjust the dose of your medication, and, you know, to make up for that slight effect of anticoagulation that cannabis has. Very good point. Thank you very much, Tanya, for bringing that up. Blood thinners are one of the other medications that you want to watch for this.
Excellent, excellent. Well, we're coming up to 12:50. We're coming right up on time, and I want to thank everybody and thank Katie for joining us and giving us so much great information. We're so thrilled. She's going to be leading our webinar series this year. Next month, we're going to be talking about sensory processing disorder, autism, and cannabis, and family therapies. Later this year, we're also going to be having two webinars on mental health, and one specifically on post-traumatic stress disorder. So stay tuned for that. And we've also got one coming up about performance, physical performance, and how to recoup after exercise, as well as menopause and women's health, which we're all really excited about. We hope everybody shows up for that, and tell your friends. I want to talk a little bit now about the Consumer Cannabis Council and what we're about. So the goal for the Consumer Cannabis Council is that we want to educate, support, and protect and celebrate the consumer, and that they are free to find peace, freedom, and comfort through a cannabis-based solution, however, whenever, and for as long as they see fit. And our goal is to help educate older adults and not so old adults, older adults, that how this medicine can really transform their healthcare and their own self-care. Because at the end of the day, we don't want it to be take 2 pills and call me in the morning. We want to have a more integrated and personal ownership of our health journey and how we feel throughout the day. And so the Consumer Cannabis Council, our mission is to help pave the road and help create a clear path for adults to get the help and resources they need to live the life they want, however they choose. And so if you'd like to be a part of that organization, you can reach out and sign up for free right now at consumercannabiscouncil.com. We have more webinars coming, and they will all be free. We've got some in-person events coming. So if you're in the Chicagoland, greater Chicagoland area, we'd love to see you there. And then we're also going to start doing some AMAs, or Ask Us Anythings. And so we'll start doing those in the coming months as well. So we can, essentially have office hours where people can come in and ask questions and get the help that you need to make the choices for a healthy and cannabis-based lifestyle. So thank you guys very much for joining us. We're thrilled. Katie, thank you once again. If you want to get a hold of Katie, it's a Modern Compassionate Care, and we'll be posting information on that on the website as well. And you'll be able to get all this information and recording of this webinar through the website at consumercannabiscouncil.com. And when that is up, I will send a link out to everybody, and so you can find it easily. So Katie, once again, thank you very much. Folks, have a wonderful rest of your week, and stay sane.
Thanks, John.